Good afternoon. Welcome, everyone. Welcome to part of our series of trainings for street outreach programs, which is really focused on people who are supervising street outreach staff and programs. And this is a two-part series. We have a session today, and then the next session is on the 19th at 1 p.m. And we're looking forward to spending the time with you guys on this material. I'm here with Andrea White. Andrea, you want to wave and say hello?
Hi.
Okay, and we're your facilitators from Housing Innovations, and we are providing support to street outreach programs as we move forward and implement lots of new changes in Connecticut. So we're thrilled and honored to be here. Andrea and I at Housing Innovations are really committed to outreach and have worked on street outreach for decades and definitely since before some of you were born, because I know how old some of you are. And so we really are committed to this work. We know how hard it is and that special people do outreach. And special people do outreach who are also really busy. So our goals are hopefully to give you some tools that you can use right away, make this a good use of your time, give you an opportunity to meet some colleagues. We'll have a couple of breakouts, but also really be relevant to the work you're doing. So, speak up. We have a couple of polls, we have a couple of breakouts to engage you and give you a chance to talk. But if we're talking about something, you want to share an example, you have a question or comment, raise your hand, type in the chat, unmute and talk. But we definitely love to hear from you. We'd love to see you if your camera ready. So turn your cameras on. And now I see Molly. So Molly, do you want to just say hi and welcome?
Hey, everybody. Sorry, was having some audio issues, but thank you all for being here. I'm so excited that everybody's here. I'm really excited that Housing Innovations is able to give us some of this content. I know that there's been a lot of interest in having some kind of standardized information available for supervisors across all outreach program types. So I'm really excited about today and appreciate you all being here.
Thanks, Molly. And I will say, and Molly made me think about it, both Andrea and I have been supervisors and we've both been supervised. And we really feel for you. And we know that it usually is really the toughest job in an organization where you're mediating between the front lines and administration. And I became a supervisor before I had any training.
Yes.
And then I got some, and that helped a lot. And so we really are glad that Demas has given us the opportunity to provide this to you because supervisors don't really get a lot of training that's specifically targeted to them. And this is part of a larger series of support. So we'll also, love to hear from you about other topics that come up as we kind of go through the material together and plan trainings for now and the future. Make sure you put your name the way you want to be addressed. If you have a particular way you want to be addressed by rolling over your picture and clicking on your three dots, but also we have a pretty large group, so it's too large to go around and do introductions. But one of our goals is to help connect you to each other. Is if you would just put in the chat box your name, your agency, your location, like what can you're in or city or whatever, and answer the question of the day. We like to start the sessions by clearing out whatever is pressing your mind when you walked into the Zoom room, the virtual room with us, and think about if money was no object and you could go anywhere in the world for a month. Now, isn't that a nice thing to think about?
Yeah.
Where would it be? And I've got a chance to think about this question a few times because we've used it as a deck clearer before, but I hope it gets some of you to smile and think about places that excite you or something else, something other than whatever was pressing you before you walked in the room. I'm seeing the chat start to pop.
Nice.
Hawaii, a lovely place. Spain. He's thinking about
Italy.
these places. We have a staff person who's moving to Spain. She just made that decision. Former staff person.
Puerto Rico.
Anywhere outside the US. That's kind of the sentiment of the day, isn't it?
David, does that mean you want to spend a month at homeless hospitality?
Yeah, if you could go anywhere for a month, Thailand, oh, a lot
Yeah,
of tropical places hitting the list here. Where it's
Norway.
because we're in cold weather places. Nobody's saying, I want to go to a really cold place. Go to Antarctica. I put Nepal. I had spent a month in Nepal before, and I would love to be able to do it again. We were just talking about that. That was so cool. Home to PR. PR is beautiful. I've been there many times, Pacific Islands. All right, we're all at the beach. That's where we're starting. It's cold
Fiji.
in Connecticut and in New York. Andrea and I are in New York. Shannon's in PA. It's cold in all those places. Fiji, we're just getting warmer and warmer. So, well, hopefully that gave you a little smile and maybe you took a breath before we dig into the content. We always have a lot of material and it is relevant to your work, but hopefully you kind of come to it from a different place. One thing we've learned in these trainings is that not everybody's desktop or laptop has a microphone. So you can use your phone as a microphone since we do have breakout groups and we like everybody to participate. This way you could talk to your colleagues. You can use this phone number. Shannon is always great about putting things in the chat. And I'm guessing she will put this in the chat too. Call this number. There's the meeting ID and the passcode, and then you can use your phone as your microphone and your computer as your video screen. So we like to go over, it's a 2 hour session, that will be with you to 3:30 and hopefully not a minute later because then you got things to do. You already have things to do, but we're going to talk a little bit about a model of supervision, which I think I always reflect on what was it like in my early days as a supervisor. This was something I found very helpful and is now in its fifth edition because it's such a great model of supervision and a great book, simple book to read. And then we'll talk about the goals of supervision, some of the key structures you want to put in place. Supervision is more than a one-on-one meeting, and we'll talk a lot about that. It's team meetings, it's trainings, it's having policies and procedures so people know what to do, it's having resources. It's really about support. So we'll talk about some structures to support people, some specialized things we want to attend to, given that it's outreach work, given that we have people who are meeting housing providers and needing community resources, and then we're gonna wrap it up. So that's our agenda. And obviously we've already said this, so I'm not even going to talk about what's really in the first packet paragraph, but it's a tough work that you guys are doing, trying to help people transition from the streets to housing with limited housing resources, limited PSH slots. But the goal is to help people to transition and hopefully transition with a network of care and support that will help them make it in the housing, whatever that is, whatever that housing looks like. And when we're providing support to staff, we're using this Kadushin model to really make sure people know what is the model. Connecticut has a model of outreach. It has standards. That's what this supervision training will, in the next part two, go into some of the standards that supervisors need to pay attention to. But what is the model? It's a housing focused case management model. It's very much a motivational model. So making sure people understand the model, that we're providing support to workers. It's tough work. The clients that people are working with have been through awful things. There's vicarious trauma, there's burnout, there's low pay, there's people have to work two jobs to support themselves. So really providing support to workers, both, on the emotional sides of the work, but also in terms of skills and managing the tough stuff that comes up in the work. This is the most complicated, and especially street outreach is often the most complicated clinical work in the community in any setting. That includes the hospitals, that includes the prisons, that includes the jails. And then also the other job of the supervisor, and this may be your least favorite, it's a lot of people's least favorite, but kind of monitoring the work, making sure the goals are met, making sure the paperwork's in, making sure, all those administrative tasks are taken care of. But also, as I mentioned earlier, supervision includes other things like what are your hiring practices? What are your job descriptions? How do they support in helping you find people to do the work? Having policies and procedures, especially around safety, around roles of staff versus, vis-a-vis outreach people, having policies and procedures that help people know what to do because it's very complex work and situations that arise can be a little bit hairy. We did a whole session on de-escalation in the best practices series, but we want to also provide training and resources to people so that they're continually, and we are providing a lot of support here. Everything is going to be recorded and put on the web so you can use it to train new staff. We have links later that we'll share with you for other trainings, and we're really trying to provide the full range of support you'll need, including also training for some of your agency administrators. And the last thing I just want to say about supervision is this job of being a program supervisor, usually in the middle between the agency leadership and the front lines, is tough and it's very demanding, and as probably demanding as being on the street. And sometimes I know some supervisors who said it was easier to be working on the front lines, right, than being a supervisor. It can be really tough, especially depending on what your agency's like or what your boss is like. But supervisors need support too, and that's an important part of the work. And hopefully you are getting support from your organization. Letting you come to this training is great because it's giving you time to focus on yourself. But hopefully you are getting some support in your agencies around the work that you're doing. And if you're not, that you ask for it. I mean, if they say no, they say no, but ask for it. So we have a poll, it's actually three polls about kind of where supervision is at for you. First question is how long you have been a supervisor. And I guess we didn't think that maybe someone is not a supervisor because it doesn't have an A. So that's the first question. And some of you may just be planning to be supervisors, and that's okay. So just put less than a year. We'll put you in that bucket. The second question is, have you received training on being a supervisor? Yes, no, not sure, other. Do you receive individual supervision, one-on-one meetings from your supervisor? Going to the point we made about this is a difficult job and everybody in the chain needs support. Everybody, the whole way throughout the organization needs support.
Huh.
So I don't know, Andrea, if only you and I are the ones who only the host can see the results, or if everyone can see results. I have no idea because I'm always
I think it's
doing the
just
poll.
us.
Okay. All right. So it's been about a minute. I'm going to give a few more seconds if anybody wants to answer these questions, and then I'm going to end the poll. We have about 14 responses and share the results. And so we have a mix here in this group. People who are newer, it's really spread almost into quarters. It's kind of funny, between less than a year and over 10 years. So interesting. And we are always trying to pitch that we are covering everyone in the audience, and it's always a challenge. And this one's a big challenge. So make sure you take advantage of what we said about comments and thoughts, especially those of you who are over 10 years as supervisors. Andrea and I can always stand a correction or an enhancement. Hopefully people saw that as a joke. Then the question on have you ever received training? Okay, 86. That's wonderful. I don't know if there was any typing in the chat on that other. Is there anything in the chat?
Yeah, Dave received had supervisor experience in different settings, so
Different
not
settings.
yeah.
Yeah. Got it. And then do you receive individual supervision one-on-one? Yes. Oh, I love that. 92%. I'm
Wow.
so happy to hear that. Andrea, did you want to say something?
No, it's just unusual. I was surprised when I saw it. No, but that's great.
These people in Connecticut, they're always at the forefront.
That's true.
Always doing the best in evidence-based practice. So, well, we're glad to know who's here and also that people are getting training. I think that's great. It's really a gap in the field. So we mentioned this supervision framework, and I want you to read the book because it's well written if you have time, or at least take a scan through the book. But it's referenced there. It's in the fifth edition. Will probably be updated again. I think originally 1992. It's how old I am when I read it in social work school, but kind of frames out these three primary roles we want to think about. And when we're a supervisor and we're providing supervision to our teams and our programs, are we attending to the administrative functions? We've already talked about that. The educational functions. helping people do their jobs and have the knowledge they need. And then the supportive function, supporting staff, help people with professional development. And I think that's something that's very much part of a social work model and may not always seem to be obvious. But when we're paying people what we're paying them, and unfortunately we're not paying them as much as we'd like to be paying them, one of the benefits to work, and I think that helps motivate staff, is that they see us as helping them grow professionally, develop new skills, maybe become a team leader, maybe go to school if your agency can provide, school tuition reimbursement, those kinds of things. But I do think it is an important part of being a supervisor in this field is to help people grow in the field and in their own. But that's something you can take back and debate at your agency. So what are the goals? We've already mentioned that, supervision is important. This work is not just an individual worker. Everybody's got a great individual worker on their outreach team. I know them. I can always spot them from a mile away. They're amazing at engagement. They're amazing at working with people. Um, but that's not what makes a team. A team is really a group of people rowing in the same direction, who have the same approach and model, and have a coordinated way of responding to a really complicated problem, right? And in Connecticut, thinking about that as a can-wide approach, and I know the cans are all different, but there are multiple teams within the can, and sort of seeing the supervision and support as helping to make that whole system work well and for each worker to be a part of that team and a part of that process. So the teamwork piece and the agency support are really critical. The goals are good services, achieving the goals and outcomes, which are very clear, support the complex needs. I've already mentioned all these things, and making sure staff know what the practices are. So some of the things we're going to be focusing on in our work, in particular in outreach, is timely movement towards housing. Right, really, that's really what we want to help people do. Hopefully, is leave unsheltered homelessness. So that's really one of the key focus areas. And because it's complicated, helping workers make decisions and solve problems, right? And I know some of you more seasoned supervisors, and I know you're really good at that. But I also know resources, sharing resources. There's a lot of turnover in this field. So people knowing what the resources are, being hip to the resources, making sure people are getting new resources, getting the documentation right. We've got to do that for funding. We've got to do that so that a worker can take a vacation and somebody else could pick up the case. We've got to do that, for compliance. Also thinking about the weighting of assignments. If you do an assigned caseload in your outreach team, sometimes people present different kinds of challenges, right? Everyone's a human and an individual, and it may be, thinking about the match between the worker and the person. And the participant may make that choice and decide they're talking to Andrea, not Suzanne. They would actually pick me and not her, but
Ah,
uh um but a client may make that decision that they're talking to one person, but also thinking as a supervisor, are there certain, might it be better for a female to be outreaching to this particular participant for various reasons, or a male, but also thinking about the level of need that's being addressed, right? So if somebody's working with somebody who has not a piece of paperwork in place and has a lot of complex needs, maybe you want to balance that with someone who might be in a different place in terms of needing support. Of course, safety in the field, outreach is outside, right? It's outdoors, it's in places that can be dicey, it's in places that can be dangerous. Sometimes it's even just from slipping and falling if you're in the woods and things like that. So focusing on people feeling safe in the field, and making sure that we are doing things to help people with that plan. Best practices and barriers. So this we'll talk a lot about. And Andrea's a real fan of this. What are the patterns you're seeing? What are the things that are repeatedly coming up? What are the common barriers? What are the challenges? What's happening a lot? What are you hearing from everybody? But also what's working, right? And really, especially since this work is hard, rising to the top to people, the good work they're doing, right? Every day, preferably, right? Trying to say to people what they're doing that's right, because it feels frustrating, it feels hard. They're usually talking to you about what's hard or coming to you with what's hard, but really trying to highlight successes and best practices so people can feel competent. The same way we know working with participants in the program that highlighting their successes make them feel competent. The same is true with staff, right? All those motivational strategies that we talk about work with staff too. I think with this group of folks, people on the street, can vary in terms of the clinical pictures, but we have a lot of substance use, misuse. We have a lot of mental illness. We have a lot of PTSD. We have a lot of medical conditions. We have an aging population. So lot complex clinical pictures. And so sometimes what we really might need is a specialist to come in and talk with the team and try to, or the person do some consultation and figure out what is in fact going on with this person. Maybe they've had a brain injury. I think that's one of the things that's really common and we don't have resources around is people have been, because of fights a lot of times actually, which is a very common reason for brain injuries, that we think it's one thing that's causing their behavior and it's something else. And, our response will differ if it's a traumatic brain injury versus chronic substance use, right? Is in terms of the problem. So helping to get that special, and I know this is tough. I know this is tough to get a neuropsychiatrist to come to the team, but sometimes it's just a nurse or a specialty doctor, right? So thinking about what can we bring to the team and partnering. This is where like partnering with a good FQHC or medical provider in your community can also be an important part of putting it together. And then looking at the practice critically and working on improving it, right? And I think that's built into the way you all work. Just to move us along more quickly, but not to make you feel overwhelmed. But here's a list of what a supervisor or team leader roles. It's so long, it goes on to 2 slides. So I'm going to read it really fast and then I'm going to ask you what I missed. But you see the person in the picture's got 9 arms, right? It's a really big job. It's those three nice buckets that we talk about in the Kadushin model make it seem simple, but it's a lot of tasks, coordinating the team, mentoring, supervision, meeting scheduling, case reviews, assignments, training, documentation, advocate with resources for agent and the agency administration. That alone could kill you sometimes. Relationships with community-based providers, clinical consultation, developing program policies and procedures, monitoring, evaluation, chart audits, helping people with managing their time, which can take all your time, trying to help people manage their time so they're getting the work done. Staff evaluations, timesheets, budgets, reports, and then of course let's celebrate everyone's success and recognize those successes. So throwing a party for the team or otherwise doing team building activities. So what's missing from the list? Anything on first pass that you do? I know there's something missing. Whenever we put this up, someone says, oh, you're missing this or that. But all that's to say is we know the role is complex and there are a lot of things to do. Is anybody giving me the answer here? An answer of something else? Okay. I'm sure there's more that you do, but it is a really complex role. And I think that's where some things that you might be getting and I guess part of the message is to make sure you're advocating that you have the support and the skills to do the jobs that are on that list, right? And like I'll just say, think about my first budget and I underspent wildly. Okay. I only did that once in my whole career. Because I learned, first of all, I didn't even know I was supposed to spend all this money. So the agency neglected to orient me to the budget. But then like just assuming that someone would know how to manage a large budget with multiple funding sources. So making sure you're asking for support to do the jobs you have to do. I want to just reinforce that. So yeah, I see something. Yeah.
Yeah. Cheryl also said assisting with a walk-in client in need. And absolutely. And there are going to be times where I'm sure some of you guys are picking up some caseloads of people that are out or have left the agency, those sorts of things, so that we know many supervisors have caseloads, which makes it really hard to juggle the 90,000 things that you're supposed to do.
Thanks, Cheryl, for bringing that up. And then Alanette also said self-care, which we do have a slide about self-care, but yes, self-care is important. And then also, of course, teaching people how to do better self-care, of course. So whatever you do, you've got to also teach everybody to do it. But thank you for adding those things. I really appreciate that. And I think that's absolutely true, especially in any direct service program. I know you always have to do some interventions with clients, frankly. I guess I don't think I ever was a supervisor in a program that I didn't sometimes have to intervene with clients around things. So thanks for that. Okay, now it's a chance for you guys to talk to each other. And I guess one thing I've learned from having a few different supervisors, from being a supervisor, is that the things sometimes I learn things in amazing ways and from people, and they really turn a light bulb on or something like that. And I think I learned how to be a supervisor by having good supervisors
Mm-hmm.
and doing the things that they taught me. And I can share a whole bunch of stories, but this is not about me. It's about you. So we're going to break you up into groups, and introduce yourselves to each other. If you at least take a minute to say who you are to each other. I know that we did that in the chat, but we do want you to make connections, maybe your agency and how long you've been supervising, and talk about an amazing, okay, italicized experience you've had with a supervisor, that was helpful, instructive, right on, or otherwise changed your approach, solved your problem, or gave you the tools to do something hard or new, and discuss what was most helpful. And of course, as soon as we wrote this question, I thought, well, what if someone doesn't have an example? So then maybe you can use an example of a good supervision experience. And I'm sorry to hear that, but you can use an experience of when you did something really maybe good as a supervisor if you want to share that. Okay, thanks, Kelly, for letting us know. And we know you guys get pulled away with stuff, and if people can't join the breakouts, we get it. But we'll assign everybody to a breakout room, and we'll give you, we're gonna make the rooms around 4 or 5 people, so give you like 10 or 12 minutes to talk about this. And welcome back, everyone. Welcome back, welcome back. We see we dumped a few of you out of your rooms, and we apologize about that. Hopefully you had some good conversations in there. Anybody want to share anything they heard, anything that they saw, said that might be good for us trainers to hear? Or your other colleagues who are in different groups? You guys are very shy all of a sudden for outreach people. You go into the woods, you talk to people you don't even know.
I'm still recovering from Pitt.
Oh, yeah.
Oh, yeah, that did take up a lot of time. And
Thank you for
Yeah.
your work. Appreciate it.
yes, Shannon's happy about that.
Seriously,
And
that
the-
came up in our group as well.
Oh, really? Because the
Yeah.
deadline is today.
It was Tuesday.
Yesterday.
I
So
think
thank you to
Okay.
everybody. Appreciate that. Just say get out of the way.
Yeah, and I think we learned a lesson that we shouldn't schedule the outreach trainings around Pitt
Yeah.
next year. Absolutely. I was my kind of intuition initially, but just kind of left it be, figuring, well, we don't want to change it too much. But I think it is a lot of extra work for you guys. You have to do some extra work. So, David, you unmuted, and Paul, did you guys want to share something? Share a good experience?
Go for it, David.
Well, we talked a little bit about setting our own boundaries and working with our staff around their own boundaries. Paul was saying
Yes.
folks who've had lived experience, so desperately want to help people
Yeah.
in that situation and can get really drawn in and so forth. So that's something that just, needs some conversation and some help people come to some insight around that.
It's absolutely true. I mean, a big thing that supervision brings to the table is perspective for people, because we want people to go pretty far in, right? We want them to get really close. And then, yeah, it's really hard. Sometimes you can't, sometimes you're sucked in. So that's a really great thing.
Well, and knowing what you are and aren't expected to do,
Yeah.
and how to organize that, right? And that boundary stuff around that, and what you can you do, what's reasonable. You want to help people out. What can you do when you want to maybe sometimes promise things that you can't really deliver on, right?
Mhm.
But that whole boundary issue is complex. Good. That's something we didn't even bring up, so very good. Came up in the groups. That's why we have them. Anybody else want to share anything? I'll just say, and I think I'll just say this really quickly, that one of the things I learned the most was by watching a supervisor hospitalized psychiatrically, somebody else. And I guess it's, even though I'm a reader and discusser and a logic person, the whole modeling of practice and interaction with clients, especially in this work, can be so incredibly valuable. And that one observation for me taught me so many things that hours and hours of training could not have taught me. So just a shout out for lots of different ways that we can teach, right? People. And sometimes showing people is really the way that they're going to learn rather than telling them. Okay. I'm going to hand it off to Andrea now.
Thanks, Suzanne. So let's talk about some of the strategies. Suzanne covered some of these. The first four are individual meetings with supervisees, team meetings, and group supervision. It can be a combination, case conferencing, and clinical consultations. So those things we're going to talk about in more detail in the slides that follow this. Suzanne mentioned workload management and balancing out caseloads. That's a very tricky part of being a supervisor, particularly when acuity and needs are very different in the people on the caseload, and balancing that out. Sometimes somebody sort of tips over from a lot of people who need a lot of hands-on work, and sort of working with people to balance that out and make sure that people share that, because they do need that hands-on work, but everybody doesn't. And how can we do that? The other thing that we found particularly helpful is getting people in different parts of the process so people can see the progress. It's easy to get mired down with the person that says, I don't want housing, right? And thinking this is everybody, but it's not. And, having some people on their caseload that are maybe farther along in the process can be really helpful. So managing that process is really important. Staff education and training is really important, and it doesn't just happen in trainings like this. It happens also in your team meetings, when you're talking to people in supervision. It's taking pieces of the training curriculum or the training concepts and helping people manage those. What I call it is backfilling. So the expectation is you do a plan. How do you do a plan? Let's talk about that a little bit. I know it's confusing, so let's talk about it. Sort of looking at your program design, listening to the people you serve, listening to the people that you supervise, and making modifications, and not letting something stand if it doesn't work, but also giving something a real try to see if it could possibly work in your program. The policies and procedures Suzanne mentioned are really important. People need to know what to do. And oftentimes we focus on consistency across them. She mentioned safety policy and procedure. You want all your staff to look at situations sort of the same way, so they give a consistent response, which increases safety. An example is, somebody, let's say, is in housing, or somebody's in an encampment, and they have drugs around the encampment. Do you sit down with them in the encampment, or do you make another time? Some people may be more comfortable with that situation and feel like this is their chance to work on it. Other people may not. You want some sort of consistency and some sort of compromise. So that's an example. Documentation and charting, it was never my strong point, but it's something that we really need to help staff do, and it structures the work. So helping people really do real plans, and plans that they revisit every time they visit people, is really important, and giving them input on plans and encouraging the team to give input on plans, because different perspectives often make for a richer plan. The other thing is to review outcomes with all the staff, talk about what you're shooting for, how they're doing, give them credit for the movement that's happened. I've heard a lot of these case stories, and it's nothing short of a miracle. And that, really letting people tell their stories about how they're coming to the outcomes, and then reviewing the outcomes and attaching those to it. It's also patterns. Suzanne mentioned this is my thing. It is. When I was a case manager, I always looked for patterns. I always looked for patterns when I was supervising people, to see how we could more efficiently help people to move forward. And patterns can be predictive, and that patterns do repeat themselves. So that, I guess that's the definition of patterns. Whoops. But I think that this is something that's really important. It also helps you to identify what kind of issues are coming up for your staff and where to seek assistance. It's a good example that we look for patterns of people struggling with different things to really focus in on the clinical consultation, which is part of the service that oftentimes supervisory teams provide. Doing communities of practice, allowing people to really talk through the practice and really own the practice, and talk about both issues, systems, and a range of things, as well as case conferencing. Okay, let's go to the next one.
And you don't have to do all these things yourself, but you want to
No.
be thinking about, what do you have in your environment? What do you not? What's getting done? Maybe you have a staff person who likes to review charts, or you have a big enough team that you can split up responsibilities. But, it's really more of an inventory and thinking about support in a broader sense, and also thinking about HR policies and in particular, right? So that supports staff, as we talked about, like tuition reimbursement, which we did in our organization. And it didn't cost that much, but it went a long way. So just a thought.
That's really important. I want to just pick up on something Suzanne said, which is doesn't always have to be you. It sort of mirrors what we tell the case managers we supervise, is that it doesn't have to be you, but you are identifying the problem and getting people to the right person. And that mirrors what supervisors do. And we want to mentor people to do that sort of thing. So we talked about individual meetings or meetings of supervision. We recommend weekly meetings. They can be a combination of group and individual meetings. People do need some individual meetings because remember when we talked about the Supervision Model, providing people with support, both group and individual can do that. We also want to talk about where people want to be, what they want to learn, what they're good at. Those things really lend themselves to individual meetings, and we want to make sure we do some of that as well as oversight. We want to do some case conferencing with people. We want to highlight best practices. I don't know about you guys, but I was always focused on what's our latest problem. What? This happened? What happened? Okay, let's talk about that. But you know what? We also want to really focus on people that are doing well, the case management relationship that's doing really well, and get people to really describe that in detail. People can learn a lot from it. It's a form of mentoring, and we want to really highlight that. We want to highlight best practices, where people are confirming to best practices, so bringing in the training there. We want to identify those themes and those patterns around barriers and do some group thinking about identifying resources or strategies that might help with those barriers. We want to highlight resources. We also want to make ourselves available to help people negotiate with resources. I think that sometimes, especially if there's a pattern of a problem with a resource, they're going to need your help, as well as probably your supervisor's help or your program manager's help to renegotiate those resources. We want to make those available. Oftentimes, the case reviews also provide some clinical consultation, and it's great if it can come from the supervisor, but it's also, bringing people in. We're going to talk about that. Team meetings are informational. They provide a monitoring function. It might be a good time to review outcomes, and they support people. They also track where people are in the transition. Some people, and we actually recommend this practice in team meetings, go through everybody really briefly on the caseload. It focuses people on people that you may not, sometimes the squeaky wheel does get all the grease. Or another thing, once somebody told me once, it's hard to pay attention to something if it's not on fire. And then she looked me in the eye and said, literally. And I thought, oh, okay. But you know what? I also think we need to figure out, how we're working and how we're helping people move forward who are not making a lot of noise. We want to share information. This is a good time for resource sharing. This is a great time for resource sharing. And they often come up in these meetings. Actually, they often come up in case conferencing too. I noticed some of the case conferences I've been doing with outreach, people are always offering resources. This is a great thing to happen in the team meeting. It also, you want to have a hot list or alert people to who might be in distress, because you might, it's not always the primary case manager who's dealing with that person. It might be anybody. You also want to look for that consistency. You want to take as opportunity to review some safety protocols, review the resources that are available, and sort of make a plan. This identifies best practices, and it's been very helpful to people. You wouldn't do all of this in an hour's time, though. I'm joking, y'all. Okay. We talked about individual meetings, preferably weekly. The standard is bi-weekly.
That's the
You
standard
make-
in the outreach standards is
Yes.
that individual super meetings are provided bi-weekly. So people should know that, and that's part of the training, is making sure people are aware.
Yep. You want to make that time as sacred as possible, right? Is that, I need to take somebody to public assistance, or I need to, I've got an SSI application that's pending. You know what? Let's figure out how to make this time the time that we meet together, because people really need this time. I will say, when people go to this standard and meet at least bi-weekly, preferably weekly, we see the difference in the program, and we see the difference in the work that they do with people. So this is really important. It's important that the supervisor have some agenda items, but also the worker come in with some agenda items. You want them to own this as their meeting. People do think that this is sort of oversight only, and you want to really integrate that educational piece and that support piece in there. You want to focus on the concepts. You want to name them. You want to bring them back to some of the training that people have had, or some of the work that they've been doing, or that's a beautiful piece of work on Housing First. These are the things that really reflect Housing First. That's great. You want to review interventions. You want to review participant goals. You want to talk to them about setting real goals, things that the clients can feel. You want to review those housing plans and make sure they're things that people can relate to, and ask questions about it. You want to talk about the progress. You want to talk about, trying other strategies. You want to pay attention to support around vicarious trauma and staff burnout. Some of that is handled by the other places there. You want to really pay attention to that, but you also want to be aware of what their workload looks like, what their caseload looks like, what's available to them. Thanks, Cheryl. Okay. Let's go to the next one.
Andrea, I have a question.
Of course. Yeah.
What, in your experience, do you keep notes of the meetings, or how do you document?
Yeah, usually for
That wasn't Andrea's forte when she was a supervisor, was the documentation.
Yeah, maybe you should
Just
take that
saying.
question.
But she'll tell you what you're supposed to do.
Tell me what I'm supposed to do.
Yes, I would take notes, because you want to revisit the stuff. And yes, I deluded myself that I would remember exactly what I talked about last time, and that was largely false. So taking notes during the session is a really important thing. I would also encourage the staff member who's the supervisee to take notes.
Yep. Well, and I think one of the things that I think is a transition in this field that we want people to make about supervision is they think they're being a good worker if they don't bother you,
Yes.
if they don't bring things up. And then later you hear about something that sets your hair on fire. And I think that's something, the socialization for a worker to bring an agenda, that your role is there to help them figure out these complex things, that in other jobs, you're told figure it out. And if you don't figure it out, well, then you haven't done your job. And I think we all recognize that a lot of folks haven't had specialized training. We're in the midst of training them up, or they're encountering something they've never encountered before. But really encouraging people to come with an agenda and engage their learning process with you. And even if it is just, I want to know more about this subject, right? It's not
Yeah.
necessarily, I didn't know how to handle this. But I think I feel like that was one of the biggest transitions. And I've had that conversation, especially with people who have not been in the field or gotten formal education in the field, that they think supervision is about monitoring them. And it's not, and I don't think that's what we're talking about. Yes, monitoring is a part of it, but that's only a third of it, right? We're doing support, we're doing education, and we're helping them figure out these complex situations.
I also
That's
think I want to
great
add to
question,
this.
David. Thank you.
It is a great question. I also want to add to this that Suzanne said something about watching her supervisor hospitalize somebody and how that was a really good learning experience. I would absolutely agree with that. But I would also add that it's fine for supervisees to watch you making mistakes. I've gone down roads with clients in front of staff that, I mean, clearly weren't going anywhere, right? And then, and you know what? The conversation afterwards. So I'll say to the staff member, wow, that really didn't work. And they say, yeah, that really didn't work. Why do you think that is? Right? Talk to me about it. And that people feel like they have to hit 100%, but nobody hits 100%. Well, I don't know, maybe some of you guys hit 100%, but I've never hit 100%. So that it's really important for them to see you struggling a little bit and trying to figure things out and what your process is, because then sometimes people want to be perfect for their supervisor, right? And they don't want to bother them with, why doesn't this work? Everybody else could do this. No, everybody else can't do it, and every person is different. And that's what we're there for. And let's talk about that. And having them watch you practice can be really helpful. Does that make sense? So I'll give you another example. When we do case studies, I always tell people stories about things that I tried that I thought were great ideas and didn't work. And usually people laugh in the case studies and they're like, oh, yeah. And somebody says, usually, you know what? It really worked for me. So let's talk about how that worked. And that's really helpful, right? So people don't feel like they have to be perfect. We want to focus on proactive interventions. That's really important. We want to talk about reducing crisis, which is very hard. You notice we did not say eliminating crisis. Most of the people we work with have been in crisis all their lives. They've never had enough resources to go around. And crisis is the way that a lot of our social services systems are set up. So that we want to reduce crisis because crisis can be very disruptive. And we want to help people to stabilize. So we want to talk about that constantly and be careful about the expectation. We want to encourage staff to train and build their areas of expertise and recognize great expertise. One of the things that's been really helpful in team meetings is there's always somebody on the staff who's particularly good at something, like amazing with SSI, or amazing making a psychiatric hookup, or amazing talking to somebody about substance use. You want to make them the experts and help them train other staff and talk about what worked for them. That's really important. That's equally or more important than the kind of training because they see somebody else doing it. Everybody's not good at everything, but people are really good at things. It also makes people feel good about themselves. And actually, one of the things that supervision does, and also this technique does, is helps people to stay longer. You want to make sure that they understand the role of your partners, including landlords, which are huge, right? And the roles of other team members, to know who they can get help from. And just keep repeating, nobody is expected to do this as an island. Nobody's expected to do this all by yourself. You're encouraged to get help. You want to provide feedback and guidance on the documentation, right? And I'll tell you something, I mean, you want to encourage people to give positive feedback to each other, and the best way to do that is to mentor it. Sometimes this can, in a team meeting, when people are reviewing documentation, it can turn into a competitive thing. You do not want that.
This is
You want
individual meetings. We're talking
Yeah,
about
okay.
individual
So
meetings here.
you want to make sure that the feedback is positive and it helps people move forward to do better documentation. You want to make sure everybody's reviewed on a regular basis. That can be done in a team meeting or can be done in the individual meeting or a combination, which is usually what happens. And then you want to look at client incomes definitely, but outcomes and progress on the performance measures. And you want to look at the clients specifically that person is serving. Okay. So case conference, right? It's a group problem solving effort, right? With guidance from the supervisor or clinical consultant or whoever is doing it, to introduce new concepts, try new strategies. It's focused on improving the staff knowledge, their strategies, and their skills. So you review the cases together. You can select a case in your individual supervision and ask people to review it in the team meeting, particularly focusing on things where it's going really well because we want to learn from that. It's also a chance for the staff to present their work. And I'll tell you, a big old failure of mine is we have a couple of case review outlines. Outreach did not like those case review outlines. So it worked better that I took the case review outline and asked people questions. Maybe that's the way you do it, right? I mean, people got really shy when they had to present a case and there was an outline. So we just asked the questions, right? Because people have a lot to add and we really want to get that input. You can bring in different consultations. Suzanne mentioned a neuropsychiatrist, a psychiatrist, an RN, a psychologist, an MD, an MSW, people who have specific clinical expertise. So RN, one of the things that we had a big problem with in one outreach team was they had a couple of people with diabetes, and it was really difficult to manage their medications when they were on the streets. And nurses do a lot of education around diabetes medication, and they came in and helped them. So it can be that specific, right? But you want to look for patterns in your work. It's an opportunity to try something creative, try something somebody else has tried, try something, help each other. And people really value that. And you also want to discuss stuck situations. And being stuck in a situation with a client is one of the most frustrating things. You feel like every time you move around, you're going deeper. And helping people get out of that hole is really important. So you want to discuss those. You want to discuss when things aren't moving. You want to problem solve, group problem solve. You want to offer people assistance. You also want to offer people empathy. It's a tough spot to be in, right? And that sometimes when people are in there, they get really frustrated, and sometimes it can affect how they relate to the clients. You want to help people with that and empathize because it is frustrating. Another one that people are having have a really hard time with, so this is a pattern that I've observed, is when people have a sort of looming crisis. The crisis is close, but the crisis isn't there. So their crisis resources aren't there, but they're sort of watching somebody until they can intervene. That's a really tough thing. So empathy in that and creative problem solving is really helpful. Are you guys seeing that? Is that something that people get frustrated with? Yeah. Okay. Yes.
Well, and I guess one thing, just we're talking about like structures to put in place. So
Yeah.
it sounds like you guys are doing a lot of individual supervision and actually getting it, which is like still blowing my mind an hour later. And I know when Andrea does the communities of practice, sometimes she's doing case reviews with people. Sometimes she's on a topic. I think one thing to think about is, and so, I know your agencies, I know who's here, their range and size, they're all over the state. Every place is different, but I think in service organization, case review can be structured it may be beyond outreach, right? It may be just outreach that does case review. But I think having a mechanism, I worked at an organization where we had case review every time we did a service plan update, and that brought together other people on the team to talk about that case and learn from that situation. Whatever it is, in some cases, some of you may be using critical time intervention. Maybe you do case reviews on new people that come in and people that are leaving. But thinking about it as a structure to build in, and that maybe also that's a place where somebody can shine and says they'll be the person who kind of facilitates or tees up the case conferencing in your organization or in your program. But thinking about it as a different structure, and it's like an addition beyond supervision or team meeting, because they're different, right? Case review is a different process. It's really drilling down on a particular circumstance or individual that's occurred, and the learning is different, and the group help, I think, is valuable, and sharing that goes on for people in that way. Andrea, was there something that you were looking at in the chat or
Nope.
no?
Nope, unless I missed something. If somebody put something,
No, I thought you looked down at the chat. Sorry.
I did look down just to see if there was anything there. Okay, team meetings. You want to cover things, administrative system issues that arise. It's a good time to review policies and procedures, particularly if you've just, revise them, get input from them, help people to understand them. You want to look at progress as well as barriers. You want to review some of the patterns. You want to share program standards and the program standards from outreach. Suzanne mentioned those. Those are there. And reflect on the standards as you're talking to people. You want to review the program outcome measures, and you may have set program outcome measures for your program. You may have set them, some are set in the standards about what you're going to, so that you want to look at those, and you want to look at how you're doing, and you want to make a plan. System and resource issues are really important in these meetings. It's a good opportunity for people to learn these things. It's a good opportunity to review resources, share resources in this meeting. That's something else Suzanne usually points out I was terrible at, but you know what? I got over it once I was made a supervisor. New resources that are being developed, asking for resources, feedback on, they may have asked you to intervene with a resource that there's a pattern of the resource not responding to them. You might have called Molly or Kim. You want to report back on that. You want to identify barriers to accessing resources and gaps in resources, and it could be as simple as transportation, or as complicated as transportation, or it could also be that the time frame that they offer you to go in, or that you have to do it by person, that there's no walk-in available. So you want to review those resources. You want to make sure that people are aware of them. And you want to also offer agency support to negotiate those resources. By the way, Molly has consistently, and Kim has as well, offered assistance that if the resources, remember we came up with that resource guide, and if the resources, let's say it's mobile crisis, and mobile crisis will offer consultation on people, and if mobile crisis isn't responding, you can always talk to Molly, right, to try to negotiate that. And that's something that could be brought up in this meeting. Does that make sense? Has anybody used that resource? People know what I'm talking about? Yeah? Okay. The other thing is to identify issues to be discussed in meetings with the partners, with your funders, with the CAN, using those tools to further your goals in your program and further the goals for your clients. So you want to develop some plans of working with people in crisis so the team can provide support and backup. It's difficult to work with somebody in crisis, particularly if it's an ongoing crisis. And you want everybody to be on the same page, everybody to understand the plan, everybody to have input into the plan, and to be prepared to offer support. And Suzanne and I were joking around about some people might prefer to talk to me, some people might prefer to talk to Suzanne, but that's very real. And people, might want to talk to somebody else. That's great, right? We want to encourage that. We want to offer that support. How about I go with you? There might be a staff member who's really good at employment and this person is really stuck in employment. Maybe that staff member can come with you and have a conversation about that. So that's a really important part of this work. You want to team build, you want to work together, you want to provide support to the team, you want to, celebrate things. You want to give people accolades. Some people do a shout out. One of the nicest ones I've seen in a team meeting is they give the case managers an opportunity to thank other case managers for helping them in a situation and what they did or what they taught them. And that is really well received. So thinking about ways where people can provide support to each other on this way, and also that people can get feedback from their peers on things they're doing really well is a really important team meeting. It also reinforces you're not in this by yourself. Also, taking pieces of a PowerPoint or a training and doing that in the team meeting, just a little piece. It's also identifying staff training needs and resources for professional development and really supporting that. I know you guys have a lot of case managers that are in school. As much as we can support that, that's really helpful. So that we want
And some of these things I think that we're talking about, right? Like, so kind of what could you do in team meeting? These slides could almost be a running agenda for you, right? Of things you want to make sure you're covering. Some things you might be addressing in individual supervision, but your time is limited too, right?
Yeah.
As a supervisor, you only have so much time. Team meeting can be a really efficient way to do a lot of things, but some things you do want to do with individuals, but you want to use that team meeting if you can. And, the team meeting is a perfect place to do the celebrations and
Yeah.
the kind of self-care stuff that we talked about and really model that. But any one of these mechanisms can serve multiple functions, but team meetings are, and I think you guys are real believers in team meetings and you use team meetings, and we'll know that shortly because we have a poll on that. But it really is it is a great vehicle when you're trying to get everybody rowing in the same direction and have people who might be sharing clients and are working with partners. And I guess that's the thing I wanted to throw out here, because I know every can is different and some of you have VA outreach and other outreach, and it's every can is configured differently in terms of agencies. So I also think team may mean your team for your can. And I don't know the definition of that. Maybe that's something we should have put on as a discussion item. But what are your internal teams at your particular agency? Maybe you have a really small program and it's only 2 or 3 people. Well, maybe then you want to do some kind of team meetings with your partners.
Yeah.
And I think our goal here is thinking about these structures and thinking about how you use them in your in your organization, and ways that you could mix it up perhaps, and also I think save time and resources. I think the more we can use team and cross team stuff, especially in outreach, since we're trying to have consistency, trying to cover the whole geography. I guess I just hope in your can, if you have multiple agencies, you're thinking about team both internally as well as across your teams in your can. So that's why the team meeting agenda goes on, and yet another slide.
We talked a little bit about documentation review, what's due, what's assigned. You want to encourage people to use the documentation, which provides a structure for the work in every meeting. I worry about people just working on the plans a couple of days before they're due, though I know that's a reality oftentimes with really busy people. We want to really encourage people to use it during their visits. Scheduling visits, getting geographical coverage, joint visits, backup for sick leave, those sorts of things. Those are logistical things that often happen in the team meeting. And sometimes reviewing the outreach plan. What's your outreach plan? What's working? What's not working? How can we work on this? How can maybe we need to change something? It's also, these should all be very fluid. We also want to schedule time for case reviews and clinical consultation, ask for input, and go through administrative directives, those sorts of things, patterns identified by data and outcomes, and ask people for their input about what they're thinking. It's sort of a group problem solving. So you could also do a retreat where you spend a little more time than your regular hour. Though, as Suzanne said, it's sort of a running agenda. You don't have to cover everything every time. Case reviews, the structure is often case presentations of new participants, so everybody's on the same page. Reviewing people that'll end the intervention within the next couple of months, that's really important. You want everybody's input on that. It's reviewing participants who are facing a major crisis. We talked about that so that everybody's on the same page and can offer assistance and support. The other thing
Or cannot be located.
Or cannot be located, yes. And, listening to how people have managed that, what works, what doesn't work.
What's the plan? Who's going to outreach? What
Yeah.
locations might you look for that person, especially if you're concerned about their welfare?
Yes.
So
Who can you get
people
to help
going
you?
missing, as I know, you guys are doing the count. You talked about that. I'm sure there are people you were looking for, to count and you couldn't find them. And that's a constant, I know, issue that comes up is people that can't be located and people get worried about them. I think that's a common worker issue is they get worried about folks. And
Yeah.
so where do they bring that and where do they do? And that's like another great kind of example of working across their own team and possibly other teams in the camp.
Absolutely. There is also in here the brief review of the entire caseload. This can be done in case review. A part of it can be done in individual supervision. A part of it could be done in team meeting as well. But you want to make sure that you talk briefly, very briefly, about each of the people, because otherwise it tends to skew towards the squeaky wheels. And you don't want people to think that they have to be in crisis to get your attention, and that happens sometimes. So you want to make sure that things don't get overlooked. And then Suzanne just launched a poll.
Sorry, I thought you were done with that.
No, it's fine. And how often do you have team meetings? It's single choice, daily, weekly, every 2 weeks, monthly, as needed, never.
Or other.
Or other. Oh, sorry, I didn't scroll it down.
Yeah, it doesn't present well for us, but
Give people
a quick
second.
question. Yeah, you want me to end? I think I'll end the poll. There's a couple more coming in. We'll give it a few more seconds in
Yeah.
case you're having to switch or find the button. Okay, and we have 13. I think
Yeah.
that the rest of us are co-hosts.
Over
Oh,
75%. That's
14.
good.
Okay, great.
Okay.
So, yeah, share. There
So
we go.
most people do it weekly, which is great. About 36% do it every 2 weeks. Some people do it monthly. And I don't see
So-
nobody said other, and nobody
Okay.
said never, and nobody said as needed. So okay. So that's great. Weekly is great. That's definitely the suggestion. Every 2 weeks can work as well, but monthly may not be frequent enough unless you've got other things. So if you're doing case conferencing and clinical consultation and a lot of individual supervision, it may be worked out, but you probably want to gather more than at least every 2 weeks and preferably weekly. Make sense? Okay. Go ahead. Oh, okay. I thought you wanted to say something. So we're going to do some group discussions. We're going to divide people up into groups. It'll probably be the same group as before, right, Suzanne? No? Okay. So we're going to mix people up a little bit. So these are the prompts. Remember, you don't have to go through everyone one by one, but these are just to get the conversation started, which you guys don't seem to need a lot of help with, which is great. So what are your agency program supervision practices? Are you doing individual supervision, team meetings, case reviews, and case conferencing? What support does staff need most? What's most helpful to them? And what is been most effective for you in supervising your outreach program?
And those are just prompts. You guys, this is really a chance for you to compare notes, talk about how you're doing it. Hopefully you feel free to share, maybe learn about different ways. I'd certainly love to hear about different frequencies, but make it your own. We just give you those prompts so you know you're not sitting there going, what are we going to talk about? But don't let us box you in. Not that
Thanks, Shannon.
Mhm.
There we go. Everybody's out. Sorry to interrupt you. We were just talking about that you guys rarely get to meet with each other as supervisors, right? So how was it being able to talk to each other?
I think it's really nice, right? You get to kind of hear what other people are doing in parts of the state, but
Yeah.
also, right, there's some similarities, I think, to all of our experiences, and you get to share ideas. So I think it's kind of helpful too.
I like
That's great.
knowing that other supervisors are having kind of the same learning curves, if you
Yep.
will, that I'm having. Like I expected people that I hired to be like myself and the previous woman who was doing that program. And I've noticed that the amount of independence that they have, they're like, I don't know what to do. Like, what do you want me to do? I don't know what to do. And I'm sitting over here like, where's the disconnect? Go, be great, be amazing. I know you can. So it is nice that other supervisors are also having that experience as well. And just learning that everybody, excuse me, has different learning styles and
Yep.
everything. So that is nice. I like that because sometimes I sit here and I'm like, I'm the only supervisor that goes through this. I don't know why they promoted me. Oh my God, and then to
Yeah.
hear other people, I'm like, oh, thank God, this is normal. Okay.
It is very normal. One of the staff I was supervising told me once, I know you know the answer. Why don't you just tell us? Why are you torturing us? And I thought, I don't really know the answer. And the only way we're going to come up with an answer is together. But I thought, okay, so yeah, and I had some of the same feelings. Feelings of competence are so important. To supervisors, to staff, to everybody. And I think it helps to talk to other people, right? Because this is not easy. This is
very often
hard.
in the role of supervisor, don't have a group of peers that you
Yep.
meet with regularly either, depending on your agency
Yeah.
and how
Yep.
it's organized. And I know that's one of the things I felt as a supervisor. It was nice when I did some things that were for supervisory staff to share those stories. So I'm glad that's getting there. Paul, you look like you wanted to say something, but I'm not putting you on the spot.
Huh.
No, Christina and I were in the same group. I think outreach is utterly unique in its
Yep.
sort of the demands of onboarding. I think like the street outreach standards was a huge step in the right direction, but then, you've also got incredible differences from can to can, from backbone agency to backbone agency. Like, and then, yeah, as Christina was saying, like learning styles, like, some people, I don't know, like, some people have the ability to sort of like get thrust into a new situation where things are incredibly complicated and kind of figure it out and reach out to the people they need to get the information they need and kind of piece together an understanding of it. And other people are just much more accustomed to a little more hand holding, a little more spelling out.
Yep.
And, certainly like as a supervisor who's had to train a number of outreach workers, like you see it all, and it really it's a struggle for folks at times.
Yeah. Yeah.
Yeah.
And there's also there's so many different places, I guess, ultimately where you need to get the information.
Yes.
Like so much of our work is done can-wide and in collaboration with other agencies, and it's just, it I get it. It's complicated.
Yep.
Great.
No, it's so true.
Well, thanks for sharing those things. I think we need to move if we're going to end
Yep.
on time, which is always our commitment to you guys, because we
Okay, so
know there's a million things waiting for you after this,
yes, we
maybe
know
a
that.
million and one.
So clinical consultation, I'm not going to spend a lot of time on this because we've covered some of this. You want to use the resources from your own agency, your community providers. Use those resource guides that we put together with Molly and with Kim. Specialty consultation, and it can be around anything. Like I said, it could be diabetes meds, it could be cognitive, it could be anything, psychiatric, medical, substance, any of that stuff. And remember, one of the things that we're really going to focus on is how we get people to treatment resources or other sorts of resources, how we deal with people now, help them stabilize and help them access these other resources, and they can be incredibly helpful. I just want to remind you that Molly has offered that the crisis teams, right? The mobile crisis teams will offer consultation. It doesn't have to be a big crisis. And that seems like a really worthwhile resource. And they'll talk to you about what's going on and maybe offer some suggestions. Individualized consultation with participants, that's a good example of that. They can also train staff. They can tell people what things look like, right? The most asked for thing is around mental health, and just, asking people the right questions and telling them, and also reiterating their role, which is, we don't expect them to treat schizophrenia, but we do expect them to recognize it, and not diagnostic specific, but also get people to the right place and start to talk to people about what some of the benefits of hooking up with another place would be. They can assist with coordination of care. Suzanne mentioned that having these meetings, Paul mentioned having these meetings with other programs within your CAN, you can coordinate care there. And it can also provide you with connections to services like inpatient detox was something that, or withdrawal management was something people really said. I see Molly put something in the chat. I'm trying to pull it up.
About reaching out to, if you don't have clinical expertise, to the mobile crisis and the
Great.
local mental health authority. And I think specialty staff can be hard to engage, but again, those relationships with FQHCs, with mobile crisis, because that can often help you access other services that are available if you have connections. And that's one where it may not be your job, and we're going to have a session for agency administrators to negotiate the relationship with the FQHC, but it might be. But having a relationship on a higher level and using staff from that can help you better access those resources. I'm going to pick up Andrea so we
Yep,
can
go ahead.
speed talk
Yep.
because time is running by. I think I told this story about modeling. The best way was with my story about my supervisor who modeled how to hospitalize someone. But we can do field visits together, do assessments and plans. Paul reminded me of something, and also so did Christina, that we'll talk a little bit about in the next session, which is adult learning styles. And some people learn by watching, some people
Yep.
learn by reading, some people learn by doing, right? And each worker is different and unique. And sometimes watching a good intervention or seeing you do an assessment with someone or do a set a goal with someone, or how to be in a visit in a camp might be the best way for that person to learn rather than reading about it or someone telling them about it outside of the interventions. We also want to, do some role play with people if they have to do something difficult, maybe give them a chance to practice it. We also want to, and this is says staff can critique our interventions. We want to hear their feedback. What did they think was good? What did they think we could do differently? I think one question that in the field is, what could I have done differently to be more effective, right? That we all want to ask ourselves. And sometimes there was nothing. We were amazing. We did the perfect intervention. But we want to model that it's okay to reflect on our practice and say, well, maybe it would have been better if I hadn't gotten a little bit excited when that person said that. But in modeling, we give staff a chance to critique us, to see, oh, I
Yes.
saw when you did this, how that worked. I saw how when you did this, that didn't work with a person. So I really am a big believer in going out there in the field and really showing people how to do the work. We also need to do, especially in street outreach supervision, help people think about how they're going to be in somebody's space, right? Because they're living outside. That's their home, whatever that is. It might be a camp, it might be a building, it might be a tent, but helping people think about how to be with people in a way that's comfortable, that's non-threatening, that's trauma informed, right? There's a lot about going into people's space. If you just don't go into somebody's tent, that's their house. It's like walking into somebody's house
Yeah.
without knocking, right? So it can be very helpful, I think, for new outreach staff. Although we always know there's some cowboys out there. I think outreach has more cowboys than any other field, and cowgirls out there who are like, yeah, don't worry, I'm all right going out. But I think also we want to make sure people have, as was mentioned earlier, the right boundaries in place. Friendly, but not too friendly, right? Not too intimidating, not too, not too casual. Um, do you want people walking in when people are actively using? You probably want to have a conversation about that, right?
Yep.
So we want to talk about these things. And we definitely, I like to see people in action myself. So after we've modeled things, I like to accompany staff if I can to see how they're going with people, if that's comfortable for the client. It's why it's good if you have relationships, and I think most of you do have multiple people on the team who have relationships with someone. So maybe it's another worker who goes with them, and it's not you, the supervisor, right? In most cases, I know that there is a lot of reinforcement of having two people going out in the field together whenever you can. I know that's not always possible. I think that's the recommendation, but I know that's not always possible. But, the other thing is to know if you are alone, when to get out. And that's an important thing that we have to attend to. We also want to make sure, and we've talked about community resources a lot. We keep mentioning them because the whole thing is we want to wrap people up. We want to connect them to income. We want to connect them to food. We want to connect them to free clothes, free, things that might help them get a job. And so making sure people know what the resources are, or if your team has a specialist, like this is our resource specialist who knows where all the things are in the community, but making sure people know what they are, what's out there. It's good for them to visit programs that you use, like maybe a medical clinic or a mental health provider that people go to so they know what it's like when people go in there to try and get a service. And we've already mentioned this, that sometimes access to community resources needs to be negotiated on the agency level. That having individual workers one by one trying to advocate for a service that you use frequently and repeatedly can be, first of all, really a time waster, but also might be better addressed by having a formal relationship, maybe even an MOU between you and the agency so that, or the service, so that they know who you are and maybe they do some things to help your people if you have relationships. I think we all know community resources is also relationship based, just like work with homeless people. We also want to make sure people are prepped for work with housing providers. And we know that there's limited resources in the cans of permanent supportive housing, of rapid rehousing for everybody. Some people are going to end up renting a room or going to go back with a friend or going to go back with family. But we want to make sure staff know about the housing process. What are the options? What are the expectations? What's the application? What's going to happen if you refer someone to the can and they get on the by name list? How long does it take to get a housing unit, which might be very long? We want to make sure staff know the process and the expectation that they do a warm handoff and some aftercare once people are in housing. We also want to make sure staff are attending to people's tenancy skills. And if once people are in housing, obviously we're working with the, hopefully we're working with the tenant on following the lease. But before they go into housing, we want to assess if they've had a lease before, if they ever had their own place before. We want all that stuff we talked about in the best practices session for outreach workers. We want to make sure we have a good sense of what that person's skills are and that we're giving them education on whatever the expectations are for whatever setting they end up in, right? And basic tenants' rights and responsibilities, the eviction process, so people don't get kicked out or get a notice and think that means they're kicked out. You know, Connecticut is a place with fairly strong tenant protections. So we want to make sure that staff know some of that content. So that's an important part of structuring support for people is really the housing navigation process. And we've talked a lot about training. They're obviously critical. This program is a lot of training that hopefully is helpful to you recorded. We have a list of other ancillary trainings, related trainings that are on the next slide with links. One thing I found is a really valuable experience as a young worker was my supervisor letting me train on topics that I had learned to train other staff. And that made me feel, and end up as a trainer. So who knew? When that was my least favorite thing to do was to talk in front of a group. I know it's hard to believe now as I yak my head off, but it was a great opportunity and it's an opportunity for staff development. So maybe you have a new worker and they're going to watch the best practices and outreach slides, and maybe a colleague is going to do some of the breakout groups with them, or talk them through it, or maybe debrief the training. But think about how to engage staff in being, if they're interested in it, in being training. And as Andrea mentioned, use those resources to do little mini trainings in team meetings or in individual supervision to address things that come up in the practice. So this is the training inventory. So this is all a link here. Will take you to lots and lots of trainings on different topics that are in the outreach standards that are recommended and or, strongly required or recommended for staff. So there are a lot of online resources, and this will keep growing and keep adding to. And of course, this training we have, is part of a 2-part series, and there'll be more trainings developed based on your feedback and the things that you need. So make sure you take advantage of what's out there and what's available. And then this is probably, some of you mentioned this is when we talked about supervisor roles, about self-care, and we want to model it. We want to promote it. I know as a person, I was never good at the work-life balance thing, right? But I never send emails at night. I never send emails before 8 a.m. I time my emails and schedule them, right? Because I don't want to model to staff that we expect you to read your emails at 8 o'clock at night or at 6 o'clock in the morning, right? So there's ways that no matter what your orientation is, and you got to do your own check-in here about how good you are on self-care, because that may give you a read on how you're going to be supporting that with staff. But it's really important in this work. Staff are not paid a lot. They don't get a lot of prestige when they say I'm a homeless outreach worker, right? They often have their own struggles that they may be dealing with. And then dealing with people whose lives are so sometimes horrendous and are going through really difficult things is really challenging. So we want to make sure we're keeping an eye on that with people. Do we notice a difference in Andrea's behavior? Has she been late all of a sudden, or has something changed with her as a worker? So we want to keep an eye on how staff is going, right? Your workers. Are they suddenly quiet when they used to be really outgoing? So we want to keep an eye on that. We want to teach people to take breaks, to ask for help. We've reinforced that ask for help thing. That was another thing I needed a lot of supervision on, was I thought I should be figuring all these things out. But helping people feel like it's okay to ask for help and when to ask for help, right? Then there's, of course, the usual things. Your doctor's telling you to exercise and eat healthy is good for healthcare, and avoiding drugs and alcohol. However, sometimes after a bad day on outreach, I know the first thing that I wanted was to go out and have few cold ones with our friends, but they don't help your mental health and they don't help your well-being. So we want to make sure we're talking to folks about some of those, the ways to be healthy and keep healthy. And we also want to support people in connecting with other people. That's support across the team, support around, maybe challenging issues that they're dealing with. I think one thing that's really nice about how outreach, I think is conceptualized is that everybody who's doing outreach in the can is serving all the people who are unsheltered in the can. Now, they may or may not be on your caseload, but we're all working together really to address this and helping people connect with others and other colleagues. And, simple things, take a day off, take your vacation days, model some time off, and then make sure staff do that too. I mean, I think that's something I also noticed as a supervisor was that some people tended not to take vacations, and I didn't always pay attention to that, right? Or they didn't always take days off. So take yours and make sure other people are doing theirs. So we've already, I think, rung the bell. We repeat ourselves, but that's not because we have Alzheimer's, but it's really because we know that some concepts are really important. The support that you guys provide to the people doing outreach is really critical to doing good work. We know what the focuses are: support, education, and making sure you're in compliance, right? And compliance becomes increasingly important as we have to think about reviews of programs and how we're spending our money and so on. So don't forget that part. The work of a supervisor is complicated. There's many roles, and you're expected to do a lot. And it's like being an outreach worker plus taking care of everybody on the outreach team, right? Like, because you all know all the clients, you're ready to pitch in if one of them needs help or walks into the building. So also making sure that you getting some support and supervision. I'm so thrilled to hear that people are actually getting support in doing this job because supervisors need support. So we have no end of respect for the work that you're doing, but we do always have a few more additional resources. So this is where Shannon has put the PowerPoint slides in the chat 9 times already in the session. So hopefully you got them. All these links are live, so you can just take the PowerPoint and link to the different training sessions. The next session we already talked about is the 19th of February from 1 to 3. So it's a little different time from today. And then we're going to do the agency outreach training, which is really like sort of the larger administrative requirements in April sometime. We're just waiting for other clear dates to clear and confirm to send that out, but we'll get that out to you as soon as possible. Andrea has another community practice with you guys next
Yes.
week on February 13th from 10 to
Yep.
11. So there's the information about that. The next quarterly outreach is in March, so that's just a reminder. And then here's all of our contact information, so you can reach us as needed about anything that comes up. So I think that's our wrap today. Gonna stop sharing. We're 3 minutes early. So Shannon can pause the recording.